Mass incarceration, which embodies the excessive and extensive use of incarceration as punishment in our country, and then the laws and consequences that continue to affect people even after they're released, have affected health in a number of ways.
Many of these policies that seem totally detached from the health of individuals and communities are intricately wrapped up in how it is that over 50 years we now see the rates of hypertension, the rates of obesity, the rates of cancer going up, and especially in racially marginalized populations.
This is not an isolated experience for a minority of Americans. In fact, 1 in 100 have a criminal record now.
And there's a emerging literature that really shows that, in fact, if you're the partner of a person that's been incarcerated, if you're a child whose parents are incarcerated, there are actually significant health impacts that affect them too.
We are focused on leveraging health systems to end mass incarceration, and in doing that through our clinical care and the programs that we run, actually caring for individuals coming home.
And then having that clinical care inform our research, our education, and even the legal and policy endeavors we're taking on.
The point of the SEICHE Center is to research, explain, and make a difference on the issue of healthcare during and after incarceration.
Those that pass through the criminal justice system often don't have access to the healthcare system until they're incarcerated. They're newly diagnosed with all these conditions that are, common among those that are justice involved. And when they come home to the community, then they actually don't have a way of accessing healthcare.
Our Transitions Clinic is one program that's part of a national network of programs.
The clinic was set up to provide primary care and other services to people leaving incarceration.
Our motto is we'll see people 2 weeks or less after the incarceration. Sometimes they don't have medications. If you come home and you don't have meds and you've been getting meds consistently, we don't want to break that up.
Coming home, you be skeptical because you're like, okay, I'm coming from this environment and they're telling me to come here, and are the doctors effective?
And they need that person to support them, because I'm a formerly incarcerated woman a couple of decades ago. That's the other unique thing about our clinic at Transition. Community health workers have a history of incarceration, so who better to assist somebody, support somebody.
And then it's in clinical care addressing the periphery of issues that surround coming home from incarceration.
We bring law students and lawyers into the medical setting to address health-harming civil legal needs.
For example, not having a driver's license because of some barrier,
which impacts people's ability to get a job or get housing or get public benefits or just function in society.
Because this has been an issue across our patients for decades, our medical legal partnership proposed a bill
that passed unanimously through the Connecticut state legislature and was signed by the governor to improve the practices at DOC with the goal of making sure that every person leaving incarceration has a proper state ID.
To bring in lawyers, to bring in psychologists, to bring in formerly incarcerated individuals, their own expertise, community leaders. We now have sociologists, geneticists, bioethicists, data scientists collectively thinking about how is it that we can better understand the health harms of mass incarceration, and how is it that we can better do it both in clinic but also in state legislature, I think is the most exciting part of our center.